There are three reasons why Obamacare is shrinking the labor force. The first is that it contains $1 trillion in tax increases over the next 10 years. And I don't need to remind your viewers of why $1 trillion in tax increases would shrink the labor force. The second thing is that there's this employer mandate that requires every business with more than 50 workers to offer health coverage to those workers. That increases the cost of labor and means that employers have less money to hire more people. So they have to hire fewer people. So that's point number two. Point number three is that low-income people will be eligible for these subsidies to buy their insurance plans. And as a result of those subsidies, because those subsidies have an economic value, people can work fewer hours and make the same amount of money that they did before. So that naturally creates an economic incentive to work less.
There you go. People are calling it a steep subsidy cliff, okay? That's kind of what I'm seeing around. It pays to work less, because then you might have a lower income, but you get a bigger subsidy for a bigger health care plan. Because if you work more, not only do you lose your subsidy, Avik, I needn't tell you, but you might go into a higher tax bracket. So it's like a double loss. Now, this is the dumbest thing. This is not just Obamacare. We're going to talk later in the show. A lot of these anti-poverty programs have the same problem. But why don't they try to fix this, Avik?
Yeah, so one thing I want to caution you on is that any plausible plan that reforms the health care system in such a way that we stop over-subsidizing the wealthy and actually direct some help to a true safety net is going to have this effect to a degree. The problem with Obamacare is the effect is very, very large because of all the other economically destructive things and wealth-destructive things that Obamacare does. So, for example, this Coburn-Burr-Hatch Senate Republican bill that we all like to replace Obamacare, that bill will have some of the same effects, but to a much more modest degree.
All right. Dick Morris, on top of the rise in premiums and deductibility, and you can't get your doctor, you can't get your hospital because they're out of network. Now we've got the CBO numbers, as you well know, showing a massive equivalent of 2.5 million job loss. Republicans are saying, I told you so. What is the political impact of this in the 2014 midterms?
I think it's devastating. I think that every day we learn something new about this law that we don't like. The steep cliff that Avik was talking about, who was on my radio show earlier today, if you make $62,000 and you live in Wisconsin and you're 55 years old and your income goes up by $1, you lose $13,000 of government subsidy. And I think that the problem is this is exposing the fundamental weakness in all 81 of the federal entitlement program,
right,
and giving everyone a crash course about what Europe is all about.